Well, hola from Ajijic, Mexico on Lake Chapala in the state of Jalisco. I'm Bob Henderson. I'm the Nomad Dad for the Nomad Capitalist. I'm going to be talking about healthcare today. We were down in Mexico to get things started in our new home that we're going to spend part of the year in down here. And I ran across a couple of ladies from Texas who were visiting, thinking of maybe coming here. And she said, you know, our big concern is healthcare because it's so good in the United States. Of course, they've got MD Anderson, the cancer hospital in Houston, which is preeminent. But she said it's so good. And I thought about some of Andrew's previous videos where he talked about, well, it may be in the United States, but it's not the only place that it is. We do know here in Mexico that, and if you're going to come here for any period of time, you probably want to buy medical evacuation insurance. You can be stabilized here pretty inexpensively and then transported back to the United States, back to your local town, whether you're on Medicare, where things would be largely picked up for you, or whether you're younger and you have your private health plan. You might want the evacuation insurance, and you definitely want travel insurance when you travel outside the U.S. And oh, by the way, if you're on Medicare, it doesn't cover you outside the United States. Technically, $50,000 lifetime benefits. So essentially, there isn't much coverage. You can't count on that. You have to either buy local coverage or you buy travel insurance coverage from a variety of insurers in the United States, which we do every time we travel. So healthcare in the United States, yeah, it's largely been preeminent, but we're looking at a situation now where a lot of people want free healthcare. There is no such thing, but they're moving that way. Bernie Sanders, of course, pushing for a single payer. I wanted to go over a few of the myths. I'll never forget, somebody said the things that are free, and I'm not sure who this was, I remember this, the things that are free you can't get, and the things that you can get aren't free, i.e. you have to pay for them. What are they talking about? The things are free you can't get. Well, if you're going to have single payer, just look around the world. Look at the UK, look at Canada. You're going to have situations with rationing. You're going to have situations with availability. In other words, you can't call the doctor like that you can in the US today, or go to an emergency doc in the box, as they call it, urgent care, as easily. Because if it's free and everybody's going, there's got to be some push. The other thing is, a lot of doctors are not going to be doctors anymore because they're not making enough money in a public system, and so maybe there are fewer doctors, and therefore the availability becomes more of an issue. Did you know in the UK that 20% of the people are on a private plan? A private plan, because they know that the National Health Service is not going to properly take care of them. Let's talk about the National Health Service in Britain for a little bit. After World War II, Britain essentially went socialist, and they socialized medicine with a National Health Service. It was an absolute mess, along with everything else. And 30 years later, Maggie Thatcher came along, but she and all her successors over the last, since 1980, so that's 40 years, have not been able to fix the National Health Service. So Boris Johnson today is so pleased that they saved his life when he had COVID that he is willing to raise taxes to the highest levels in peacetime to maintain the National Health Service. But it's not going to fix it. And Britons that can afford to be outside the system are. Let's talk about some of the other countries. People think, well, it's single payer if you go to the Scandinavian countries. You pay, if you're a middle-class person, $70,000 of U.S., it'd be the same as $70,000 of U.S. income. You're now paying a 55% tax rate plus 16% VAT tax, value added or more. And you're not paying for health insurance, but look at the significant increase in taxes. So in effect, you are paying for it. Look at some other countries where everybody thinks it's free. It is not free. It is not single payer in France. It is not single payer in Germany. It is not single payer in Switzerland. In fact, in Switzerland, they rigidly enforce an individual mandate, which was part of Obamacare, which was undone by the Trump administration. And I think a lot of Democrats thought that that was a good idea as well, because nobody screamed too loudly about undoing the individual mandate. And the average American would have rather paid the fine and got up to $600-700 a year rather than pay the premium for Obamacare. So we've now undone the individual mandate. But really, if you want to have a system that remains afloat, you've got to enforce it like Switzerland does, rigidly enforces an individual mandate. So there is no such thing, we know this, no such thing as free health care. You're either going to have to pay higher taxes if you want a system commensurate to what we have in the United States today, or you can have something like you've got in some of the second world countries where, yeah, it's kind of free, but the health care is not nearly as good. And you might want to opt for some kind of private plan, much like 20% of the British population does. Those are my thoughts on healthcare. It's still great in the United States. I highly respect it. I think dental care is tremendous, for instance, and it's very important. Good dental care is good for your overall health. There's no question about that. Never forget, I went to a doctor when we lived in Phoenix. He says, say ah. I said, ah, and he goes, good, dental health. I went to my dentist next time and I told him what the doc said. But it is so important, to your overall health to have good dental health. And I think dental care in the United States is fabulous. And I'm not complaining about the health care either, although I think it's gotten a little bureaucratic. I don't like that as much. You can't talk to your doctor as much as you used to be able to one-on-one. But nonetheless, if we go to single payer, it is not a panacea. And if you want it to remain at the level where it is, you're going to have to pay for it somehow. And that probably means through higher taxes. And I'm not sure the average American is willing to do that. I'm Bob Henderson. I'm the Nomad Dad for the Nomad Capitalist.